I'd now like to introduce you to Dr. Sebastian Chung, who works in Steve Larson's lab, and his presentation is on flaming cocktail recipes for malignant ascites.
Now, I'm no mixologist, but I'm sure many in the audience, like myself, can appreciate a flashy flaming cocktail to spice up dinner. Well, it appears some cancer cells might express this vice as well. In our lab, we hope to serve our recipes of liquid radiation to cancers that demonstrate preference for certain flavors and medicines, so we can find them on imaging and treat them without affecting neighboring non-cancerous tissues. In other words, I want to get these cells drunk, because as you can imagine, the drunk ones are easier to pick out of a crowd. Now, more specifically, I'm interested in treating something called malignant ascites. This is a form of disease that's spread throughout the peritoneal cavity and the abdomen and can originate from the appendix, colon, or ovaries. This is an incurable form of disease in which chemotherapy is minimally effective, and I, as a surgeon, am unable to completely cut it out. So how do we make our cocktails? So first, I start out with a splash of Magic Bullet bourbon. This is the antibody in blue that this cancer cell has particular preference for. This is only going to those cells. Then I add some garnish and top it off before sending it off to our radiation chemist. And they add liquid radiation and set it on fire. That goes to the patient. Now, each cancer is different, and each recipe is personalized, because only those cancer cells express that antigen that the antibody will bind to. Only they receive the burn, meaning they light up on our imaging PET CTs or receive a therapeutic dose of radiation, or both. Non-cancerous tissues that don't express this preference for our antibody are spared. And for someone who comes in with a different type of cancer, I might switch up this antibody. For someone coming for a second treatment, I can change up the radiohaptin, or the liquid radiation, based on the preferences I already know. Now, the crux of this pre-targeted radioimmunotherapy is the specific binding of this antibody to the tumor. If I select the wrong antibody, I might not find the tumor on imaging. Or worse yet, I might burn the wrong tissues. So ultimately, the goal is to combine precision immunotherapy with various cocktails of liquid radiation so that we can successfully image and treat metastatic cancers. And in fact, we hope to, we're applying this, and an iteration of this is being applied to MSK trials later this year. And I hope to share these updates with you in the near future. Thank you for your time.